Hi everyone. So for the past 3 weeks, we've tackled so much about nursing informatics. This video is a compilation of all the reflections that I have come up with, how I understand the course, and how it's important in the nursing practice. So during the week 2 of the course, we have discussed what is nursing informatics and how it differs from health informatics. Why do nurses need to develop nursing informatics skills and how the nurse leaders will use this information in the nursing practice. As technology evolves, the level of care adapts to its development. According to Carolyn Sipes, nursing informatics as a new, evolving discipline is an established specialty within nursing. Our objective as nurses is to give the best possible care to our patients. Because of the increasing aging population, patients' health care demands have become increasingly complex in recent years, which is why the nurse's responsibilities must must cope with and adjust to the more intricate and digitalized form of healthcare system to ensure safe and high quality care. We gather data, analyze it, and develop a systematic guideline that will present the right information to the patients and to improve their condition. We coordinate with other members of the healthcare team to resolve a specific ailment that the person is experiencing. For instance, nursing staff can use informatic solutions to identify patients who are at high risk for serious conditions resulting from drug allergies or falls. By placing an alert sign in the patient's file, other practitioners will be notified and preventive measures can be taken sooner. In conclusion, nursing informatics must be a core competence for nurses because this skill will assist nurses in communicating and analyzing data to achieve improved outcomes. I feel that if we have a better grasp of electronics, we can encourage safety measures that reduce the danger of medical errors. As a result, I believe that including this course in the nursing curriculum will allow future generations to be more logical and efficient in providing patient care. So the reference that I used in this week two reflection is the book from Carolyn Sipes, 2019 edition. This is the Informatics Definition, Evolution, Guiding Principles, Expectations, Application of Nursing Informatics, its competencies, skills, and decision making. This is published by the Springer Company. So for the third week, the course discussed about the roles of nursing informatics in Canada and the guidelines that the Canadian Nurses Association and the Canadian Association of Schools of Nursing have come up with. So according to the Canadian Nurses of Association, or the CNA, the goal of nursing informatics is to improve the health of people and communities while reducing costs. As a result, the trend toward person-centered approaches to care delivery that focus on health promotion and illness prevention will be intensified. They encourage the use of information and communication technologies, or what we call the ICTs, which will add value to our healthcare system while decreasing costs. So, to attain a patient-centered approach of health and wellness, involvement with digitally connected health services environments is necessary. The Canadian Association of Schools of Nursing, or what we call the CASN, defined three entry to practice nursing informatics competencies under the domains of information and knowledge management, professional and regulatory accountability, and use of information and communication technologies. The purpose of these nursing informatics competencies and indicators is to guide curriculum development. The competencies cover the fundamental abilities that new registered nurses must have to practice in today's advanced technological environment. I believe that the use of these ICTs will be beneficial for nurses and clients, as both will benefit from positive nurse-patient relationships, and that incorporating ICT into client care enhances the quality of interprofessional patient care. As the Canadian healthcare system upgrades its quality of care, nursing informatics will also improve decision-making abilities by utilizing new ideas and methodologies to gather, process, analyze, and interpret data. I am confident that these principles will be extremely beneficial to nurse leaders as they apply them across the continuum to guarantee safe, high-quality patient care. The references that I used with this reflection is from the website of the Canadian Nurses Association and from the website also of the Canadian Nurses or the Canadian Association of Schools of Nursing. Uh, their topic about the nursing informatics entry to practice competencies for registered nurses. For the week 4 of the course, the topic discussed is about the basic information about computer and its hardware and why it is important for nurses in the role of the nursing informatics. Electronics have progressed and are driving the society we live in today. High technology environments in healthcare facilities are now available for use to improve patient care. Smartphones, tablets, and various applications are now commonly used to facilitate communication between departments. Being computer literate is advantageous as a nurse who deals with a lot of patients with multiple diseases in different settings. This is a skill that I feel every nurse should have since it will help you communicate quickly with other clinicians who are dealing with the same patient as you. According to Carolyn Sipes, in the 2019 edition of her book, she said, if the skill set you need is not yet developed, there are many opportunities today to develop these skills within your own practice. So, in order to navigate the files of patients through the latest system, a nurse must first learn the basic functions of a computer and its hardware. With this knowledge and expertise, nurse leaders can document and plan patient care professionally, respond quickly to clinical reports and warnings, and most importantly, use technological tools to improve the outcomes of care processes. Perhaps most members of the healthcare team, particularly the older ones, may find it difficult to understand and adjust to these changes in their regular job routine. But when you think about it, these technological advances will assist the majority of patients' holistic development. So for the reference I use for this week's reflection, I use the same book of Carolyn Sipes, 2019 edition. It is the Nursing Informatics Definition, Evolution, Guiding Principles, Expectations, published by the Springer Company. After reading what you've wrote for all your reflections, do you think you have met the learning objectives? Why or why not? I believe that I have met the learning objectives for each week. I was able to briefly discuss every topic that has been explained and was able to give my personal thoughts and learnings with regards on the application of these skills of the nursing practice. What areas of your studying help you to meet the learning objectives? I think what helped me the most here are the resources provided for each topic. The list of books and video presentations help me understand and guide me in writing all my reflections all throughout the 3 weeks of the course. What could you have done better to meet the learning objectives? What studying strengths and weakness do you have that contributed to either your success at meeting the learning objectives or in not meeting them? I think exploring and reading more articles and journals helped me in doing or help me to do better in attaining the objectives mentioned for each week. I think the way I spend time on the reading materials and exploring other articles over the internet helped me a lot in meeting the objectives. On the other hand, I think the lack of time management is one of my greatest weakness in not meeting the learning objectives because sometimes I tend to search and read more over the internet without minding the time. That's why I tend to lose um, so much time with one certain objective or to one certain objective. How did you use technology to help you to be successful in meeting the learning objective? I think the use of internet, I mean browsing the internet for ideas for each week's subjects was really helpful in attaining each objective. Also, um, by exploring the library site through the Seneca library, I think this access is really helpful to me or to all the students because this um, site provided sufficient materials to meet the course objectives. So there it is. This is the end of the video. All the reflections that I made for the past 3 weeks of the topics or the objectives that we've tackled for the past 3 weeks of the course. I think this video will also help others in understanding the course. Thank you.